Hello everyone, thank you for joining me today. The topic we'll be covering is one that can literally save lives: the 6 early symptoms of colon cancer. We will discuss each symptoms under the following headings: why this happens, supporting data, key insight or key takeaway. Then we will follow it with the importance of screening and early detection, why screening matters, supporting data, what you can do, and finally, conclusion. Before, here are some general facts about colon cancer, also known as colorectal cancer. After breast and lung cancers, colon cancer ranks as the 3rd most common cancer globally, accounting for 1.9 million new cases every year, according to the World Health Organization, WHO. Despite this, many people aren't aware of the warning signs until the cancer has progressed to an advanced stage, when treatment options may be limited. What's especially concerning is that while colon cancer is typically seen in older adults, recent studies show that around 10% of cases occur in people under the age of 50. In the United States alone, the American Cancer Society estimates that in 2023, there will be over 153,000 new cases of colorectal cancer. This rising trend in younger adults is often referred to as early-onset colorectal cancer. Early detection is key, and one of the best tools for early detection is regular screening through colonoscopy. Unfortunately, due to economic barriers and health system limitations, many people, especially those under 50, may not have access to regular screening tests. That's why it's critical to know the symptoms of colon cancer, even if you're younger or don't have regular access to screening. Today, we'll walk through the 6 most common symptoms of colon cancer, explain why they occur, and provide you with key information backed by statistics and research. Understanding these symptoms might not only help you or someone you care about, but it could also be life-saving. Symptom number 1: change in bowel habits. The first symptom we'll discuss is changes in bowel habits, an important sign that something might be wrong in your colon. According to clinical data, nearly 2/3 of patients with colon cancer report some form of change in their bowel habits. Types of changes: diarrhea. This could be frequent and persistent, not associated with usual causes like diet or infections. Constipation, persistent constipation that doesn't resolve with dietary changes or over-the-counter treatments, can be a warning sign. Narrow stools. If your stools become thinner, resembling a pencil, it could be due to a narrowing of the colon caused by a tumor. Changes in stool consistency or color. In some cases, stools may become mushy or looser than usual, and the color may change due to internal bleeding. Why this happens? Changes in bowel habits occur because tumors in the colon can obstruct the normal passage of stool. The anatomy of the colon helps explain why these changes happen. The colon is divided into 2 parts, the right side and the left side. The right-sided colon, consisting of cecum, ascending colon, and right half of the transverse colon, processes liquid stool. The left-sided colon consists of left half of the transverse colon, descending colon, and sigmoid colon, and handles more solid stool. Because of this difference, left-sided colon cancer often leads to more obvious symptoms like constipation or narrow stools. In contrast, right-sided colon cancer tends to cause more subtle symptoms, as the liquid stool is less likely to create blockages. As a result, right-sided colon cancers may go undetected for longer, which is one reason they are typically diagnosed at more advanced stages. Supporting data. A study published in the Journal of the National Cancer Institute found that left-sided colon cancers are often diagnosed earlier because of their impact on bowel habits. Meanwhile, right-sided colon cancers have a poorer prognosis, as they tend to be diagnosed later due to less noticeable symptoms. Symptom number 2: blood in the stool. Our second major symptom is blood in the stool, and this is often one of the most alarming signs that prompts people to seek medical help. Blood in the stool can take two forms: bright red blood or black, tarry stools. Why this happens? Left-sided colon cancers tend to cause hematochezia or bright red blood in the stool. This occurs because the tumors are located closer to the rectum and the blood remains relatively fresh as it passes out of the body. Right-sided colon cancers, on the other hand, can cause melena, which appears as black, tarry stools with a foul odor. The reason for this is that the blood has more time to break down and oxidize as it moves through the digestive tract, resulting in a darker color. Supporting data. The American Cancer Society notes that rectal bleeding is a common early symptom of colon cancer, particularly in cancers located closer to the rectum. However, not all bleeding is visible. Many cases involve occult blood loss, where small amounts of blood are shed over time, leading to anemia rather than visible blood. Key insight. Even if you don't see blood in your stool, anemia can be a clue that you're losing blood internally. This brings us to our third key symptom. Symptom number 3. Fatigue and iron deficiency. Anemia. Fatigue is a common symptom of many conditions, but when it's coupled with iron deficiency, anemia, it could be a sign of internal bleeding caused by colon cancer. Why this happens? Iron is essential for producing hemoglobin, the protein in red blood cells that carries oxygen. Without enough iron, your body can't get enough oxygen to your tissues, leaving you feeling constantly tired. Tumors in the colon, particularly in the right-sided colon, can slowly bleed over time. While this bleeding might not be visible, it leads to a loss of iron, which is critical for producing hemoglobin, the molecule in red blood cells that carries oxygen. When your hemoglobin levels are low, your tissues don't get enough oxygen, leading to persistent fatigue, weakness, and shortness of breath. What you should know. According to the National Institutes of Health, NIH, about 30 to 50% of colon cancer patients develop some form of anemia due to chronic blood loss. It's important to note that while iron deficiency anemia can have many causes, such as menstrual blood loss in women of reproductive age, it's a serious red flag for colon cancer in postmenopausal women or men. If you fall into one of these categories and are diagnosed with iron deficiency anemia, a colonoscopy is highly recommended to determine if bleeding from the colon is the cause. Key message. Fatigue alone isn't always a sign of cancer, but unexplained fatigue combined with iron deficiency, anemia, should be investigated further, especially in men and postmenopausal women. Symptom number 4, unexplained weight loss. The fourth symptom is unexplained weight loss. It's natural for weight to fluctuate. While many people celebrate weight loss as a positive thing, losing weight without trying, especially more than 5% of your body weight over 6 to 12 months, could signal a serious underlying condition like colon cancer. Why this happens? The reason for this weight loss is twofold. First, as tumors grow, they consume more energy from the body, diverting it from your normal metabolic processes. Second, advanced cancers can affect your ability to absorb nutrients, leading to further weight loss. In addition, advanced tumors can block the colon, making it difficult for your body to absorb nutrients, leading to weight loss. Supporting data. According to the National Cancer Institute, NCI, unintended weight loss of more than 5% of your body weight over 6 to 12 months can be a sign of a hidden malignancy, including colon cancer. This is especially true if the weight loss occurs alongside other symptoms such as fatigue or changes in bowel habits. Key takeaway. If you experience significant weight loss without dieting or increasing your exercise, it's important to seek medical advice. A thorough evaluation, including blood tests and possibly imaging studies, can help identify the cause. Symptom number 5, abdominal pain or cramps. The fifth symptom is persistent abdominal pain or cramps. While occasional stomach pain is common and usually harmless, ongoing discomfort that doesn't go away could be a sign of colon cancer. Why this happens? It's normal to experience occasional stomach cramps due to indigestion, bloating, or food sensitivities. However, when these pains become persistent or don't go away, they may be a sign of colon cancer. This can occur when a tumor causes a partial blockage of the intestines, leading to pain and cramping. It's also worth noting that abdominal pain can be more pronounced depending on the location of the tumor. Right-sided colon cancer. Pain may be dull, vague, and persistent, often in the lower right abdomen. Left-sided colon cancer pain may be sharper and more cramp-like, especially after eating. Again, occasional discomfort isn't usually a cause for concern, but if the pain is persistent and occurs alongside other symptoms, it's crucial to seek medical advice. Supporting data according to Johns Hopkins Medicine. Persistent abdominal pain, especially when combined with other symptoms like changes in bowel habits or blood in the stool, should always be investigated. While pain may not be the first symptom of colon cancer, it often indicates that the cancer has grown larger or spread to nearby tissues. Key insight. It's important to differentiate between occasional cramps caused by indigestion and persistent, recurring pain that could indicate a more serious issue like colon cancer. If the pain doesn't improve over time or is accompanied by other warning signs, it's time to see a healthcare professional. Symptom number 6. Bloodstream. Infection with Streptococcus bovis. Our final symptom is a bit more specialized but still critical, a bloodstream infection with the bacterium Streptococcus bovis. While this might sound unusual, it's a significant finding in the medical community. Why this happens? Streptococcus bovis is a type of bacteria that naturally resides in the human gut. However, if this bacterium enters the bloodstream, it often points to an underlying condition such as colon cancer. In medical literature, Streptococcus bovis bloodstream infections are strongly associated with colon cancer. In fact, up to 80% of patients with a bloodstream infection from this bacterium found to have an underlying colon malignancy or precancerous polyps. The mechanism behind this is believed to be that cancerous tissue in the colon provides a conducive environment for the bacterium to thrive, leading to bloodstream infections or even endocarditis, which is an infection of the heart valves. Supporting data, a review in the World Journal of Gastroenterology highlighted the strong association between Streptococcus bovis infections and colon cancer. One theory is that cancerous tissues in the colon create a favorable environment for the bacterium to proliferate, leading to bloodstream infections or even endocarditis, an infection of the heart valves. Key takeaway. If you are diagnosed with a Streptococcus bovis infection, it's essential to undergo further screening for colon cancer, as this bacterium is often a marker for an underlying malignancy. The importance of screening and early detection. Before we conclude, it's crucial to emphasize that early detection remains the best way to improve survival outcomes in colon cancer. While we've discussed 6 key symptoms, it's worth noting that many people with colon cancer, especially in its early stages, may experience no symptoms at all. Why screening matters. A colonoscopy is considered the gold standard for detecting colon cancer. It not only allows doctors to view the inside of your colon, but also enables them to remove precancerous polyps before they have a chance to turn into cancer. Fecal immunochemical tests, FIT, and stool DNA tests are less invasive options that can detect hidden blood or DNA mutations associated with colon cancer. Supporting data. According to the American Cancer Society, people who undergo regular screenings have up to a 68% lower risk of dying from colorectal cancer. Furthermore, if detected early, colon cancer has a 5-year survival rate of 91% when localized to the colon. However, once it spreads to distant organs, that survival rate drops to 14%. What you can do? If you're over 50 or have risk factors like a family history of colon cancer, regular screenings are essential, even if you're younger and screenings aren't recommended for you yet. Knowing the symptoms we've discussed today can help you catch potential issues early. In conclusion, colon cancer is a serious disease, but it's also one that we can detect and treat early, provided we know the warning signs. The 6 symptoms we've covered today: changes in bowel habits, blood in the stool, fatigue from iron deficiency, anemia, unexplained weight loss, persistent abdominal pain, and bloodstream infections with Streptococcus bovis, are all signals your body might send if something's wrong. Don't ignore these signs. If you or someone you know is experiencing any of these symptoms, seek medical attention right away. Early detection can make all the difference. Thank you for taking the time to learn about this important topic today. If you found this information helpful, please share it with others who may benefit. And don't forget to like, share, and subscribe for more health-related content. Stay informed, stay healthy, and take charge of your well-being. Wherever you are, have a good morning, good afternoon, or good evening, and see you soon.